Hi Zanji, I'm coming on again this afternoon just to kind of tell you what happened to me last night, about 7 o'clock. It was horrible. It was one of the worst things I've ever experienced. I suppose mainly because I hadn't got a clue what it was and what was going on. So, um, if you don't like, I mean, it's not really medically medical, but if you don't like stuff, then maybe skip this video. And I'm really sorry for TMI. But what happened was we'd had our tea. I said probably about 6ish last night, and it was probably only about 6:30. I think we were sitting watching TV, and I said to my husband, I said, "Oh, I've got a bit of stomach ache." And now that isn't unusual for me. Since having my gallbladder out, I do very often get like a little bit of a tummy ache, and I sort of have to dash to the loo, and that's it. But I don't feel ill with it or anything like that. That's just normal. It's fine. No problem. So that's what I thought it was going to be. So anyway, I say sorry for the TMI. Had to sort of make a dash to the loo, and I just sat on the loo. Oh dear, just sat on the loo, and I felt really strange. I can't even quite describe how I felt. Really, to start with, I just felt really odd, and I thought this isn't, not stomach wise, just generally in myself, and I thought this isn't normal. It's not my normal sort of thing. So the only way I can describe it is my brain was fine. I was like fully with it, but oh my god, I thought I was going to die. Honestly, no joke. I felt clammy, I felt hot. And one of the first things that happened was my tongue was all like not numb, but I was like I was like I couldn't talk. I actually couldn't talk. Um, it's like I couldn't coordinate my mouth. It's like what? And I didn't know whether I was going to be sick, whether I was going to pass out, whether I was having a heart attack, stroke. I honestly couldn't talk. I was trying to call my husband and nothing would come out. I couldn't I couldn't move. My body felt like really heavy. I say I was sweating. By this time I'd got palpitations in my chest. My hands were tingling, and I don't mean like nerve tingling like they normally do. I mean like tingling all over. My body was tingling, and I'm thinking, what? I didn't know what to do. I thought, I'm either gonna sit here and be like this for ages until Mick comes upstairs to see where I am because I've been gone for hours, or I'm gonna pass out or faint, have a fit or something, or it'll pass. I just didn't know what was going to happen. So all I could do was sit there. And it sounds really weird. But after what felt like forever, which probably was only 10 minutes, probably, I managed to get into the bedroom. I was shaking like a leaf, and my phone was in the bedroom, and I just dialed Mick's mobile, and I just managed to get help out. So he comes dashing upstairs going, where are you, what's wrong? And I'm sitting in the bed, and I'm on the bed rather, and I'm just like, I can't talk. God knows what he must have thought. Apparently I look grey, sweaty, clammy. Now if that had been him, I complained at this this morning. If that had been him, I would have taken one look at him, not being able to talk, sweating, clammy, chest palpitations. I'd have called an ambulance. But he didn't. He went and got a thermometer to take my temperature, which was normal, by the way. I was shaking like a leaf. By this time, I was starting to feel not myself, but I could kind of coordinate myself a little bit. And I felt so cold. So he kind of like got me sort of onto the bed and covered me up with a blanket, sort of sat me up. Oh, it's just so weird. My heart felt like it was going to out my chest. He took the last week or so, what was concerning me was the last week or so, my blood pressure's gone up a little bit after my surgery again. And it's probably to do with the nerve damage. So I am actually getting that looked into again now. But of course, my first thought was my heart was thumping. Was it something to do with my blood pressure? Was something happening? So he took my blood pressure, and it was I had to write it down because I had to have a consultation with the nurse about my blood pressure as it happens this morning. It was 175 over 153. So not good, but not surprising considering what I was feeling. So eventually, after probably about half an hour, I kind of began to feel a lot more normal. I think I had to go to the loo again. But my stomach going to the loo didn't seem, it was almost like that was one thing and everything else was something else. It was just really weird. So anyway, I went downstairs. And I'd probably been downstairs about 5 minutes. I had to dash to the loo. And then apparently, while I was in the loo, Mick had to also dash to the loo upstairs. I was downstairs. So, okay, sorry for TMI. So, actually, that made us both feel a lot better because it was going to be probably something we've eaten rather than something wrong with my blood pressure or my heart or something weird happening. So, we both sort of felt, I know that sounds weird, but we both felt a lot easier that we were both having some sort of symptoms. So, I think it was about 9:15 by this time, and we both said, I want to go to bed. We just shattered. I don't know what it was. It just totally made us just so tired. So we both went to bed, and I think he was okay. I think he said he had to get up once more in the night, but apart from that, he didn't have any other symptoms. He was fine, really. He just had a little bit of an upset stomach. So I went to sleep, got off to sleep perfectly okay. And then I woke up, I think it was about 3 o'clock, and I did have to go to the toilet again. And I felt, apart from having a bit of a wibbly tummy, I felt okay, apart from still had a little bit of pressure in my chest. So I thought I'm going to phone, 111, the out of hours, for not an ambulance or anything, but just for advice. So I was telling her everything, and I said, like, it kind of started with a tingling in my mouth and like I just couldn't talk. And she said, have you eaten fish? And I said, yeah, we had fish for tea. She was like, oh, it's it's called, I'm reading this bit because I won't remember it. It's called scombroid food poisoning, or sometimes called scombroid fish poisoning. Now normally, it says that it normally is in tuna, salmon, like oily fish, or mackerel, and there's a few other fish I think that you only get in Australia. And what it is it's not a bacteria as such. What it is, sorry, I'm just reading this. In fact, I'll read this bit out because it'll explain it better than I can probably explain it. Scombroid food poisoning symptoms are initially similar to some allergic reactions. Onset of symptoms varies from minutes to hours after consumption of fish with high levels of histamine. The time before onset of illness and the range of symptoms depends on how much fish is eaten, histamine level in the fish, and the individual's histamine tolerance of the consumer. Symptoms generally persist for 8 to 12 hours and resolve with no or limited medication. e.g. antihistamine within 24 hours of consumption. So basically what it is, she was explaining on the phone, and then I googled it, as we do. It's when whoever's catching the fish or processing the fish, it's normally in the processing, they don't keep it properly, and a bacteria develops and you're not actually reacting to the bacteria, and it's not a fish allergy like being allergic to fish. What happens, this bacteria converts, if that's the right word, or produces histamine, as in the opposite to antihistamine. And once this histamine level starts to be present in large numbers, it multiplies. So with anything bacterial in the fish, you can cook it, you can steam it, you can freeze it, and it will kill the bacteria. But there's absolutely nothing that will kill these these histamine levels. Now she said, it was cod that we had. Now cod isn't normally an affected fish, but she said there could have been, when they were processing the burgers, all it needs is a scrap of mackerel or something to end up in that fish burger, or some sort of cross-contamination, then it not be processed or stored properly, and you've got your problem. So just because cod isn't normally an affected fish, it doesn't mean to say that it can't be caused by this. She said it's kind of good that you were both affected, even if your husband was only slightly affected, because it does suggest that it's something that you've eaten rather than something more sinister. The symptoms may include tingling, burning in your mouth or throat, facial flushing, greyness, itching, skin inflammation, and in more serious high cases of histamine, you can get rashes and hives all over your body, sweating, nausea, vomiting, diarrhea, abdominal cramps. So I think we can safely say that that was what the problem was. It does say that in absolutely severe cases, you can get blurred vision, respiratory distress, and swelling of the tongue. And if it closes down your or your breathing and that, it can actually be fatal. And basically she told me, obviously you're over the worst of it, take an antihistamine, which I'd got some in, some I think there was lucky they were still in date. It was from some old hay fever medication from my son, I think. So yeah, but she said the scary thing is as well is, she said, had you had the fish very long? And I said it was on my last Tesco shop, which was about 2 weeks ago, and it was Young's as well, so it wasn't like a cheap, I mean, Young's are known for fish, so you'd kind of think that they would know what they're doing and take care, but obviously not. Although saying that, it could have been Tesco's, they could have kept it out, not had it in the freezer for a while, and it had been the problem. And unfortunately I hadn't got the box, I hadn't got the room to put the box in the freezer, so I froze it in. It was in like an inner sealed bag, so I just put the inner sealed bag in the freezer. So obviously all the barcodes and traceability codes are all on the box, which went in the recycling last week and got emptied. So I can't even like warn Tesco that there's possibly a problem with their batch. Anyway, so yeah, I say she did say that once the histamine starts to increase in fish, like the longer you keep it in your freezer, the more and more and more it's actually increasing. So she said it's probably a good job that we ate it kind of sooner rather than later. Like, should, if it had been in the freezer another 3-4 weeks, whatever, the levels would have been much higher and you would have possibly been much more poorly. So she said there is that's lucky. But yeah, scombroid fish poisoning, I'd never even heard of it, but it's not uncommon apparently. And she said very often people will go to A&E and they'll just say, oh, you've got a fish allergy, but there is a way of actually testing for it in hospital. They literally do a blood test and test your histamine levels. But she said, I don't think you need to go to a hospital now. The only thing she did say, which is what I told my husband off for this morning, given my symptoms last night, he should have phoned an ambulance because it could have been heart related. I mean, obviously it wasn't, so that was good. But she said, tell him if you ever have those symptoms again, call an ambulance. And she also said, if I do get those symptoms again without eating fish, obviously get checked out just in case it isn't that. So I just thought I'd share that with you. I don't think I'll be eating fish in a very long time. The thought of eating even fish fingers now just makes me feel ill after that. So yeah, if anybody else has ever had this or heard of it or know anybody who's had it, just let me know, because I say I've never heard of it. So anyway, thankfully I'm here, live to tell the tale, and I'm fine. I'm eating and drinking as normal today. Tummy just keeps gurgling every now and again, but as to everything else, that all went last night, so I think I'm okay. I'm doing okay. So I really don't want anything else at the minute. I've got so much going on with everything else. I don't want anything else. So anyway, I'll say goodbye and I'll speak to you all soon. Bye.